Namaskar, I am Dr. Asha Baxi, Lead Consultant, Motherhood Hospital, Indore. My main field of interest is infertility and gynec endoscopy, though I deal with high-risk obstetrics and gynec cases as well. The reason I became doctor is, one is in our times, medicine was really respected and there was lot of respect in the community for doctors. And another turning point for me was my father was very ill and he passed away at a very early age. So that time I understood that what medicine is and how medicine can help the human beings. So that was the reason me and my brother, we both became doctors. The reason I chose obstetrics and gynecology is I had interest in surgical field as well as medical field. And I found that obstetrics and gynecology was such a field where I could practice my knowledge of surgery as well as medicine. And another thing is obstetrics and gynecology is a happening branch. Always there is happiness, most of the times there is happiness, and when that baby comes out, it's a different experience. And I thought this is a best branch, because otherwise I have a tendency to get depressed soon. So if I deal with a branch which keeps me positive, happy, I wanted to go in that branch. Oh yeah, I love to talk. Yes, I like to communicate with people, I like to meet people, I like to travel, which I'm sure everyone does. But at the same time, I like a little bit of sports. So I love to play table tennis. When I was a student, I won several awards also. And then I love to do yoga. Usually I do yoga, and recently I've started learning a new thing, and that is kickboxing. You'll be surprised at this age I've started learning this, but I'm thoroughly enjoying it. And if possible, I love to do swimming and lots of activities. So I try to keep busy. If I'm not busy professionally, then I'm busy with the other things. See, now at my age, I have been through so many patients, and lots of patients I can't remember offhand. But one patient where I felt very good was, this was a patient who was almost, I think, 130 kilo. And her husband was also 140, 150 kilo, and they were trying for treatment. They had been to other centers, and they had hardly, there were 1 or 2 eggs, and nothing happened, and they didn't succeed in their IVF. So when they came to me, then I asked them that, really you want to get pregnant, you don't want bariatric surgery? They said no. And for us, we just got 2 eggs in that patient, and we got 1 embryo. That embryo we transferred, and somehow with great difficulty, step by step, with all the hurdles in between, everything, all the high risk factors, we could take this patient up to 28 weeks. And I think around 700 grams baby was born, and that baby they took home, and now that baby is almost, I think, 3 or 4 years. So this was a patient where everything was impossible and still we could achieve. So there are many such patients, I can't often tell you, but we do get all challenging cases, and many a times you don't want to treat and the patient is after you that, no, I want treatment. The patient has so much confidence in you that you also start feeling that, yes, I'll do my best, and sometimes God gives us all the strength and the results are there by luck.